Okay, let's continue on. Let me tie all this together for you. First, I don't think it's a good idea to go into a store, even this office, and just start taking supplements with reckless abandonment. Because what could happen to you is first you can cause an imbalance inside of your body. You know what else? You're going to waste money. Because you might be taking a zinc product, but you're also addicted to pastry. Instead of wasting your money on the zinc product, stop eating the pastry. Oh my God, did I say that? Right? And that would be to your advantage. So, does anybody have any questions?
I do.
Go ahead.
All right, you was talking about the iodine for the thyroid?
Yes.
All right, does that help your thyroid if it's unactive thyroid?
Okay, that's a good question. See, there's a lot of confusion with iodine and the thyroid gland. Because a lot of conventional medical thinkers will tell you not to use iodine at all. Your thyroid gland needs iodine. Probably the biggest issue that we deal in our society today is that we don't have enough iodine in our food. Okay, number one. But listen to what I said earlier in the program. It's anti-iodine nutrients like chlorine, fluorine, and bromine. The best way to have your thyroid gland tested is to do a TSH, a T3, and a T4, which we do here in our office. And we also can do a urine loading iodine test, which has been amazing for me. We had some individuals came from North Carolina to our office, so we're starting to have people come from all over because they want to be assessed. These people were sick for 30 years. Nobody ever did their TSH, T3, and T4. Now, I'm not trying to bore you with numbers, but a normal T3 goes from anywhere from 86 to 200. They're at 70. That's low, by the way. I've never seen anybody really below 100. So we then did a urine test on them to find out how much iodine they had in their body. The whole theory is that for 4 or 5 days you take no product that has iodine in it, okay? Then the morning of the 4th you pee in a cup, you save that, that's the pre-urine test, you take 4 iodine, which is about 50 milligrams, and then for the next 24 hours you catch your urine. And then you send that to a lab. Now listen to this. You should excrete 95% of that iodine that your body took in. You say, Dr. Bob, why is that? Because your body should be saturated with iodine. I'm not trying to confuse you, but most people, like today, I don't have to go outside with a jacket on. Even though it might be chilly, my body, because I've increased my iodine, my body metabolism is increasing. So I'm taking about 25 milligrams of iodine a day. If you are really low, you could take 50 milligrams of iodine for 3 to 6 months. Now here's the issue with iodine. That's a very good question. A lot of people start taking iodine, and what will happen to them, they'll get sick. But they're not sick. You know what's going on? Inside of your body, the iodine you're taking is kicking out the bromine, the fluorine, and the chlorine. So you can get a metal taste in your mouth, you can get a rash on your head, you could get a headache, you could get nausea because the iodine is causing all those chemicals to be kicked out. So you could safely, all here, take 12 milligrams of iodine a day. What I would suggest you do is you start with a product that we use in our office called prolamine iodine. You take 1 a day for a week. It has 3 milligrams of iodine in it. You see what kind of reaction your body has. If you have no reaction, the second week you would take 3 more. That's 6. The third week you would take 9. The fourth week you would take 12. You do that for a month or so, slowly getting yourself up to about 25 milligrams. Now for those of you that just started care in the office, I really don't like patients to start taking their supplements until they went through a series of spinal correction. So I'm not saying carte blanche, go out and start taking these supplements now. That's not the purpose of this. This is an educational segment. Because you're not ready to do all that right now. So don't go to the front and start asking, you know, can I get this, that, and the other. No, don't do that. We'll tell you what to do and when to do that. But it's a process. And iodine, probably in my 30-year career, learning about trans fat, learning about zinc and iodine is probably those are the 3 biggest nuggets. That's a really good question. You always use the iodine slow. When I was in Japan, everybody thinks that the Japanese people don't get sick because of soy. It's not because of the soy. They eat iodine in the form of fish and sea vegetables. Any other questions? Bobby.
I have one. I have been craving more flax oil. Is it safe to take more? Because it's like I take my tablespoon and then it's like an hour later, it's like I just feel like I want to go drink the bottle. It's just, I feel like I just want to just...
She has a really good question. She's craving oil. During the wintertime, since we're videoing this and we're doing this during the wintertime, your body is going to use a lot more oil. That's why a lot of people get cracks in their hands because they don't have enough oil in their body. So instead of doing the flax oil, I want you to start, all of you, to increase, get some avocados in your body. Start eating a fourth or a half an avocado every day. Get some fish. Eat some nuts. You're craving oil, but start using some food as a source for oil. One of the challenges with a flax oil is that flax oil does need minerals. Flax oil does need B vitamins. So if you're craving the oil, I am sure you need the oil. Okay? But let's mix it up a little bit. Let's do some avocados. Let's do some nuts. Let's do some fish. Almond butter. Yes?
Is there a high degree of iodine in any food? Like
Well, sea vegetables, seafood are great sources of iodine. Okay? We use Celtic sea salt. Those are the three biggies. But also we have an organic source of iodine and iodide. And by the way, iodide is what your thyroid uses. Iodine is what breast, ovaries, and testicles use. And I've had men's PSA go down by adding up to 12 milligrams of iodine to their life. Iodine is really very, very important, especially if you have cold hands and cold feet. Did you have a question, Carla?
Yes, the healthier I eat, the more I'm losing weight, because the healthier you eat, I've been doing real good at that. So what do you recommend to eat when you're eating healthy? What can help me keep weight on? Because I'm starting to exercise more.
Well, what's happening, and I see this happen to a lot of people that come into the office, that people will look at them and they'll say, oh man, you're skinny. Let me tell you something. You're not skinny yet, and don't take that to be personal either. All you have to do is go to Europe or go to Japan. Those people are normal thin. In America today, we are obese. You know, we're talking 60, 80, 100, 120, 200 pounds overweight. So if you are your normal weight, you look cachectic compared to somebody else. So your body will stay, if you're eating that organic type of food, if you're eating whole food, your body will stabilize. You don't need necessarily even to go on a diet. You just got to eliminate the biggies, like pastries. I had somebody today, this gentleman, his belly was like hanging out to here. Here's a heart attack. You know when they have to pick their belly up to pick up their zipper to put it down. He was one of those kind of guys. You know what they did? They just cut back on their portions. They eliminated the sweet stuff and they cut back on portions. Portion control. It's a very novel thought in America today. When you go to the buffet, all you can eat.
And supersize.
Super size.
I was told that carrots had sugar in it. Is that good for diabetics?
Okay, good question. Carrots do have natural sugar in it. That's why I usually recommend 4 or 5 carrots a day. Chew them. They have fiber in them. They are not going to throw your body off like a banana would. Trust me. Okay?
What would help people with inflammation in the joints?
That's a very good question. What helps people with inflammation in the joints? First, eliminate sugar and dairy. Sugar and dairy always cause pain and inflammation. Second, flax oil. Walnuts will help take away inflammation. Flax oil, walnuts, mixed greens. Omega-3 fats will help take away inflammation inside of your body. Omega-3 fats. Any other questions? Okay, well listen, it's been great. I hope that you all learned a lot.
I did. Thank you.
You're welcome. Is it done?
Thank you.
Sure did.